Hello everyone and welcome to another segment of the Classical Association of Canada's video lecture series. My name is Tyson Sukava and I'm an assistant professor of ancient Greek and Roman studies at the University of Delaware. I'm delighted to be able to chat with you a little bit about my love of ancient Greek medicine today because I was born, raised, educated, and had the chance to teach in Canada before moving to the United States. In the age of modern biomedicine, we take a lot for granted. If we get sick, chances are that the medical community has some recourse to treat the condition, or at the very least to reduce its symptoms and alleviate some of the pain. 2,500 years ago, or even a little over 100 years ago for that matter, things were quite different. Any disturbance in a person's normal condition could suggest a serious illness. A small injury could result in permanent disability or death. As resilient as the human body is, it sometimes doesn't take much to disrupt health. Something that always fascinates me about the history of medicine is that it required a great deal of faith, both on the part of the doctor and the patient, that medicine is worth the effort and expense. Positive results were inconsistent in the ancient Greek world, and there was little formalization of the medical practice to speak of. You didn't need a specific degree or accreditation, so essentially anyone could call themselves a medical doctor. The question was whether you could attract patients. Nevertheless, people continued to pursue medicine's possibilities. Main reasons for its success were that doctors gave fantastically interesting explanations for sickness and treatment. There was some good publicity, and some of the physicians had strong ethical practices. The history of medicine is, of course, a long one. Its origins are lost to prehistory, and the ancient Greeks certainly did not invent the profession. The people of the ancient Mediterranean, especially those identifying with Greek culture, defined themselves by one particular approach that laid not in medicine per se, but rather natural science. According to our sources, some Greek-speaking people around 2,700 years ago, and we may call them proto-scientists, began asking whether they could explain different natural phenomena without pointing to the gods. Could it, for example, be possible to understand how the world works by studying only the visible material within it? One scientist would say that the universe's base material was water, for example, another that it was air, and another that it was made out of indivisibly small particles. Although the gods certainly were real, they thought, perhaps we don't need to look to them for answers about what nature is. The connection to medicine is an important one. A prevalent scientific theory was that the universe was made out of 4 base elements: fire, earth, air, and water. Everything that exists is either a pure form of one of the 4 elements, or a mixture of 2 or more of them. Physicians in the mid-5th century BCE, a little after the end of the Persian Wars, were attracted to this intellectual framework, and created various models around this theory of elements to explain what the human body is made of and how diseases come about. They too adopted the approach that, although the gods may be ultimately responsible for sickness and health, humans are nevertheless able to understand natural causes and produce natural treatments. The most common medical theory, which would become dominant for over 2,000 years, was the theory of the 4 humors: yellow bile, black bile, phlegm, and blood. Each of these intersected 2 qualities of the 4 elements. A major obstacle was that there was a religious and social taboo that prevented doctors from dissecting human cadavers, so they had limited opportunities to explore whether their theories were correct. Doctors imagined the body to be a container of sorts, one in which various internal parts produced, stored, and transmitted humors throughout the body. Just like the body was a miniature of the universe, they thought, doctors also believed that there should be a balance of material within it. A disruption of one humor, too much or too little, was a common explanation for poor health. In most instances, they would see too much of one humor in things that left the body, and we'll take a look at what these are in just a moment. Sometimes, if you can believe it, doctors used their sense of taste to detect which humors were out of balance when samples were available. This led to some nasty nicknames for the physicians. One of the gifts that ancient Greek doctors had left us was a collection of medical writings, many of which are in the form of medical case histories, that form a collection called the epidemics. Although there are some illnesses that we today would call epidemics described within it, a good number of the cases are about specific patient illness. This allows us glimpses of what they were seeing in their medical practices and to help us understand their approaches to sickness. Here is one representative example from the collection. In Thasos, Philistes had a persistent headache and sometimes had to stay in bed, where he slept deeply. Having been seized with continual fevers from drinking wine, the pain was exacerbated. During the night, he first became feverous. On the first day, he vomited some bilious material. Here comes the humors, at first yellow, but afterwards of a green color, and in greater quantity. Solid feces passed from the bowels. He was uncomfortable all night. On the second day, deafness, acute fever, depression of the right lower side of the torso, urine thin, transparent, delirious about midday, uncomfortable on the third day, convulsions on the fourth day. All the symptoms got worse. On the fifth day, he died early in the morning. Not a pleasant description, right? A good percentage of our case histories end, like this one, with death. And you'll notice that the doctor doesn't make any mention of treatment. Instead, the account looks more like a scientific report, with no intervention attempted. One suggestion given for this is that doctors were particular about keeping their treatments as trade secrets. But thankfully, we have other doctors who wrote entire works about the basic theories of treatment. You'll notice that the doctor in the passage above pays close attention to the patient Philistes' fluids. Because the humors enter the body in combined form of food and drink, a doctor could help regulate humors through diet. A patient could be told to drink less or sometimes more wine, or try to eat more barley to restore regularity. Famously, ancient Greek doctors also developed ways to remove excess humors from the body. This led to such practices as bloodletting, or opening up veins to release some blood, and the development of vomit-inducing or emetic concoctions, and laxatives. This really is the extent of ancient pharmacology, or the development of drugs. Knowing what substances produce the different humors, how to identify when a patient has too much of a humor, and how to get rid of that humor constituted a large amount of a doctor's expertise. Ancient Greek medicine was then, for the most part, non-invasive. Usually the most extreme treatment would be bloodletting. Now, a doctor generally only attempted invasive medicine in instances of trauma. We read of such instances in our medical records of rocks to the head, spears to the chest, or sewing needles to the thighs, all surprisingly common occurrences in antiquity. For the most part, doctors stuck to various versions of the humoral theory. It is extremely elegant, seems to explain a wide variety of sicknesses, and allows for doctors to impress patients with various types of newfangled cures. Most importantly, though, it was easy to understand. Patients knew, or at least believed that they knew, what was happening to them. But understanding what doctors were doing and how it helped didn't mean that patients weren't sometimes wary of doctors and their practices. We read, for example, of rather suspicious medical techniques being applied. In one account, the poet Strato tells the story of Dr. Socles, who put 3 huge boulders on a patient's back to correct a curved spine. The patient was crushed, but Strato quips that his spine sure was straight afterwards. Another poet questions whether an old woman died of her illness, or whether the doctor had strangled her. The authors here are obviously exaggerating for the sake of a joke. But beneath these lies a level of anxiety over surrendering some control of your body and safety to another person, who is near or completely a stranger to you. The concerns were sometimes well warranted. In fact, a medieval torture device was developed from an early Greek spine-straightening tool. Doctors held a lot of power, and it seems that some would-be physicians abused this trust. So, the techniques of ancient Greek physicians may have been generally inefficient, and patients themselves seem to waver between marveled believers and harsh critics. How, we may ask, did the profession possibly survive? The answer is a complex one, But one of the strongest reasons was a general sense in the medical community that their job was patient-centered. We're often at our most vulnerable when we are unwell, and doctors in Greek antiquity knew this. Like all professions, there were bad actors who seemed to pursue medicine for the possible fame. But one of the strongest forces behind the survival of the Greek medical profession was the development of medical ethics. Doctors realized that sometimes the best that they could do was to make the patient feel comfortable and heard in their final moments. A cup of cool water, for example, when there was no one else to fetch it, would be a gift. Some doctors were consciously aware of the power that they held and took steps to use it properly. An example of this is also the most famous ancient Greek medical writing, the so-called Hippocratic Oath. Here we read about pledges to do no harm, respect the bodies of patients, and to maintain doctor-patient confidentiality. Various forms of this oath continue to be read by future doctors in many medical schools today. Ancient Greek medicine, which was later adopted and adapted by the Roman world, became the foundation of medical teachings in Europe for hundreds of years. Development was slow going, hampered primarily by lack of medical diagnostic tools and anatomical knowledge. But nevertheless, its practice continued, in large part because of the development of ethical guidelines and the persistent hope that curing illnesses of all kinds is within our reach. Thank you very much for allowing me the chance to share a little bit of my love of ancient Greek medicine with you today. If you haven't checked out all the other videos, please do. I've watched them and they are fantastic. In the meantime, bye for now.